Hey everybody, it's Dr. Taylor with Taylor Made Integrative Therapy. Today I wanted to discuss the lymphatic system and its kind of effect on your overall well-being, but also uh, for workout, exercise, and recovery. We're going to go through a couple slides just so you get a little background, and then I'm going to show you how to work on certain areas that will give you the most dramatic effect. So before we talk about the lymphatic system, let's just talk a little bit about lymph. Lymph is a pale fluid that bathes nearly all the tissues of an organism. It surrounds all of your muscles, every cell of your organs, uh, and is mostly composed of white blood cells and water. There's about 15 liters in the average body, which is about 3 times more than the amount of blood that you have. And you replenish and recycle about 3 liters a day. So it's really important to stay hydrated and get lots of water for this system to work properly. So the lymphatic system is a network of tissues, organs, and vessels that help rid the body of toxins, waste, and other acidic and harmful materials. So essentially it's like your sewer system for your body, and it's definitely something that you want flowing properly and filtering and not to get backed up. You can see some of the stuff here. You got your thymus, your bone marrow, the liver, spleen. Those are the organs, and then the lymph nodes and the lymph vessels help comprise the rest of it. Now, it helps maintain fluid balance in the body, helps absorb and transport fats from the gut, but it's a continuous loop and it empties all the filtered lymph back into the heart to be pumped through your body again. But it is one of the most important systems to think about when someone has pain and tightness and swelling, etc. So the lymphatic system flows through three main ways. Movement, okay, so walking, exercising, whatever we're doing. The pumping mechanism of the muscles helps push the lymphatic fluid through. Um, you can also do massage. There's lots of lymphatic drainage things for people who have had cancer and they've had lymph nodes removed that can help push it back through the system. And then there is a small internal pumping system, which is kind of effective when you're sleeping. So we mentioned before, movement was the biggest factor in lymphatic flow. So a sedentary lifestyle is going to be the biggest factor in lymph not flowing or causing congestion. Other things like sleeping on your shoulder or sitting too much, turning your neck to the side all day or all night, that's going to cause a lot of tension and tightness in the muscles and obviously make the lymph not flow better. Um, Not cooling down properly after workout, it will be another thing. So I have a lot of athletes who exercise, work out. You've just created a lot of metabolic waste from like lactic acid and tissue breakdown. And when you just go and sit or lay down right after your workout, you're allowing all that waste to just kind of pool and kind of get caught in these clusters that we'll talk about in a little bit. Other things like fascial restrictions from old injuries or compensatory movements. When those injuries aren't properly addressed, you can cause scar tissue and adhesions to form. And if you have joint restriction or muscle imbalance, you also overuse certain muscles or strain certain areas that are trying to compensate. And all this extra tension can cause lymph to not flow properly, creating even more tension. And then other diseases like cancers, lymphomas, where either you've had lymph nodes removed or there's a problem with those lymph nodes working properly, can also cause some lymphatic congestion. So obviously we don't want these congested lymph nodes because when we do, you're going to have a myriad of different problems. First off, when you can't get the lymph cleared out of the tissue in the joints are going to swell and you're going to feel pain, you're going to feel tension, you're going to feel tightness, you're just not going to move properly. Your nerves run through these muscles and these different tissues, and when you have swelling in there, the nerves can get compressed. That can cause burning nerve pain type issues like with carpal tunnel or sciatica, anything like that. And then also on more of a proprioceptive, you're not going to have good joint position sense, muscle awareness, and just kind of bad input and output from your body. You also have slow healing, so the lymphatic system needs to clear out all this waste and proteins and everything like that that you've done from healing, and clear it out so that you can generate new tissue. And one of my biggest things is my fibromyalgia patients, this chronic inflammation. So when your lymphatic system's clogged up, everything gets backed up, and it's almost like you're an aquarium with the filter broken. So everything is just acidic. It's going to cause everything to hurt, everything to be painful. Light touch will be just excruciating for you, and everything's just going to feel swollen and tight. And then more along my athlete line, you're going to have poor sports performance. So If all this junk is backed up in your muscles, well, you can't get the good nutrients in, so you're not going to perform well. You're going to have fatigue. You're going to hit that brick wall really, really quickly, and you're just not going to be the best athlete you can be. Now let's talk about how we're going to get you guys feeling better. So we have these lymph nodes all over our body. They are in your muscles, along your spine. They drain your spinal disc. So anytime you're having an injury or some degeneration and inflammation and you're not getting it better, you probably have some lymph congestion in there. So these lymph nodes, again, are everywhere, but there's certain clusters. You can see here on the side of the chart here. These are the spots we want to focus on. They're going to have the biggest impact, and it's very quick and very easy. Now, you'll probably feel some swelling in this area. It'll probably be very, very tender if you're having some lymph node congestion. So we do want to release all of them, and even if you're not having any swelling or congestion, it's still really beneficial for you. So what we want to do is hit each of these spots either with your hand or with a percussor. I like the one from Vigorous Innovations, and you're just going to massage each one lightly for about 30 seconds and move on. Now, it's very important that you follow in this order because everything is kind of a closed loop system with the lymphatic system, and it's going to all drain into the heart. So we want to start near the heart and work our way out. So the order we're going to do is the supraclavicular. It is right above the collarbone there. Then you want to do the cervical. Okay, there's about a third of your lymph nodes are in your neck, and you really want to get that drained out, and it causes a lot of neck tension and a lot of pressure and congestion, and especially down the arms. A lot of carpal tunnel I fixed just working in the neck area. The other one is subclavicular. It's right under the clavicle. And then we're going to do the axillary ones, which are right on the inside of the shoulder, that little crease on the deltoid there, and then also underneath the shoulder. And I'll show you that in a second. Then the supratrochlear, which is right above your elbow. The mediastinal, which is right where the ribs insert along the sternum. The mesenteric, which is your abdomen. There's a lot in here. Again, it's part of your immune system, so anywhere things enter your body, like your mouth, your nose, and your gut, you're going to have a lot of lymph nodes. The inguinal one is right at that hip crease, which gets really, really tender on a lot of people because of sitting. We got the femoral ones and the popliteal, which are also really tender and swollen because of the sitting. So the hips and the knees really get congested really easily because of all the sitting that we do, being flexed positions. So in a second, I'm going to show you how to perform this, and we'll go through each spot together.
Hey guys, it's Dr. Taylor with Taylor Made Integrative Therapy. Just wanted to go over these neurolymphatic cluster points that you can massage very lightly to provide a lot of relief and stiffness and tension, as well as pain in your joints. This is really good to do before a workout or first thing in the morning or just whenever you're feeling stiff. I really find a lot of benefit when I'm out golfing to just do this quick little warm up, and it really unlocks my hips, my back, and my shoulders. So what we're going to do, everything, all the lymphatic drains into the heart, so we want to start near our chest and work our way peripherally, okay? We don't want to push congestion into congestion. So you'll do each of these spots about 30 seconds. First one's going to be right here under the collarbone, okay? You kind of turn your head a little bit. Again, just lightly rub, not a lot of pressure. We don't want to damage the lymph nodes. It will cause even more inflammation. Okay, and then we'll work out here towards the shoulder. Now I'm going to do this a little shorter than you normally would, just for brevity's sake, so you don't have to sit here and watch the whole thing. You can kind of get the gist of it. Okay, I like to pat the chest and then kind of milk everything back towards the heart. All right, now we'll do the other side. Now this is really good. Your lymphatic system is also part of your immune system. So, you know, this isn't approved by the FDA or anything, but if you get your lymphatic system moving, you're going to get better immune response when you do have a sickness. Get everything moving, okay? Rub it here. Now I like to go right above the collarbone. Just kind of loosen up all these muscles. This is really good if you have a lot of neck tension. Again, as part of the immune system, wherever things enter your body, like through your mouth and your nose or your gut, you're going to have a lot of lymph nodes in that area, which is what causes a lot of tension. Let's do the other side. Okay, right above the collarbone. This is also going to help out with a lot of forward head posture, a lot of tightness in the front of the neck. creates a lot of strain in the back. So if you have neck pain in the back or across your shoulders, really good spots to work on. All right, then I like to milk it down. I'm kind of running my hand right where the trap and the neck muscles meet, and I like to turn into it and kind of pull away, get a little stretch out of there. Okay, we'll do the other side. Especially if you're tense and tight and stressed at work, this is a really good thing to do. Your neck's been just straining, looking at the computer screen the whole time. Really good to get some motion in there. Other spot's going to be under the shoulder. Okay, this really gets glued down and tight because a lot of people don't put our hands over our heads all day long. You'll feel those little knots. So look for swelling, tenderness, tight bands of muscles. Those are usually where we're going to have some clogged lymph nodes. And then we'll milk it through. Okay, let's do the other side. Now again, movement is the best way to get your lymphatic tissues moving. That's why people feel better after they warm up. This is a good kind of precursor before your workouts. Okay, now we're going to come right along the ribs, the sternum here. This can get real tender, more towards the nipple line here, especially in females. This also has the added benefit of activating your diaphragm and turning it on. And then right under the pec muscle, you'll feel some nasty little knots here. And these turn on your pecs and your lats. So before your workout, this is a good little neuro activation point. Okay? And brush it up. Then we're going to go through our gut. Now you kind of have 3 lines here, right down the middle, and then kind of right on the side of the abs. There's a lot of area to work here. What I like to do is actually lay on a playground ball, something soft, something with some grip. Really loosens up before a workout, and I'll show that in another video. Okay, and this, anything below your abdomen, like your hips, knees, ankles, really good to start here in the gut and then work your way down, okay? Now this is the best one for me with golf since everything's with your hips. Kind of rub right here in the front. Okay, get right in those little creases. Get out here a little bit on the outside of the hips. Smack that. All right, now we get inside here in this inside groin area. Okay, make sure you get up high, the inside hamstring and those adductor groin muscles. Really glue down. Milk it up, and then right behind the knees. Okay, smack those, and then milk it up. Okay, and now there's one more I forgot to do, right on the inside elbow, supratrochlear popliteal nodes, right in the inside armpit. So a lot of golfer's elbow, carpal tunnel. This is a huge fix. Okay. All right, and then afterwards I like to finish up with a little stretching. So, you know, you can get on a wall, make sure your wrist is extended, turn your head, keep your shoulder rolled back. You get a good stretch out of that. Okay, you can do some jumping jacks, anything where you get some full body movement, get some bouncing, really helps kind of get that lymphatic system moving. All right, guys, I hope this helps. Try to do this every day. You'll feel a lot better. Thanks.